Hello, this is Dr. Siam again, and I am working for President Barack Obama, organizing the community for call for a national health insurance. I am proud that we are asking for this insurance to be applied to everyone living in the United States, because with all other countries abroad, civilized countries have health insurance. The health insurance does not only pay for your expenses when you are sick, but also control the corruption and the false information and some greedy doctors that take advantage of you, working with them on one-to-one basis. I had experience with those people that working on grants on medical research, and we saw how many they introduced drugs that kill so many people. Hundreds of thousands have been died from Celebrex and Avendia and so many other drugs that we have to withdraw from the market after it caused the severe damage to the community. I am not here to tell you what a disease is and so on, because you can go and Google this terminology in cancer and stuff like that. I'm here to tell you that some of our research, I will give you, for example, because I'm concerned with colorectal cancer, I would like to eradicate this on a scientific basis, not on how much money we give to those people driving a colonoscope. Looks like they're driving a taxi inside your body. In the United Kingdom, you have to be highly susceptible to the disease. And as I said before, there are certain criteria, if you see my previous video, for high susceptibility to colorectal cancer. If you are not highly susceptible, then why I have to go through your colon with a foreign object and disturb the normal physiology and the anatomy of these organs? Till now, there are some organs we do not know the exact function and what they do. Of course, the colon play a very important part in the metabolism, synthesis of vitamins, and so many regulatory functions. It is very important organ in your body. And just to go to see if you are or not have is not what we call the screening, does not worth going through your colon with a foreign object. And I am always saying that because it increased 400 times the number of people that went through colonoscopy after Medicare approved the payment, this means that before, or if we do not beg, we do not care about human being? How can you explain this? And with the screening, there is two really things now that seriously debated in United Kingdom and in the Union there. Is it worth it for mammogram expose ladies to radiation every 6 months, every year, till they get cancer, and then you said we detected, and then the other one is the value of colonoscopy in older people. Our medical record, and thanks for the introduction of electronic records, which we will follow up these patients, and we will be able to relate symptoms to a cause, to a medical manipulation. The medical manipulation sometimes cause diseases and death more than natural causes of diseases. And here I would like to get the statistical criteria of those older people who died after colonoscopy to see how they are. I have experienced a lady that was taking 16 different drugs. She is 71 years old lady, and she's taking 16 different drugs. And I looked at her medical record because her hospital allow her record to be on the internet. And with her, we discovered that her kidney is failing. Her glomerular filtration rate, which is the rate by which the kidney filter your nitrogen or the waste products, is going down to 27, which means 1 or 2 more points and her kidneys will shut off. And this is from the interaction or metabolites of all these drugs in her kidney. And immediately we went with her to her doctor and asked for a nephrologist or a kidney doctor to see her. We stopped most of her medication, and now her kidney function went up from 27 to 44, which is not excellent. You have to have more than 60 glomerular filtration rate, and it depends on black and white and stuff like that. But what I want to say is that we are over-treated, we are over-diagnosed, and all this money we spend could be saved for national health insurance. It is saving from within. It is not that will cost the deficit, looks like the Fox News are saying. It is a money we saved from medical manipulation, over-treatment, over-diagnosis, and devoted into the national health insurance. And believe me, we will not need any taxpayer money to pay for this insurance. It will be saved from within. Besides the very expensive office visits for doctors, $600 for 15 minutes, $250 and stuff like that, it should also be regulated. As far as I am concerned, my main concern is to stop overdiagnosis, and the area I am interested in, as probably you will know now, is colorectal cancer and over-treatment with medication. Thank you, and I will see you in my next video.